Hello, everybody. Welcome. It's so good to see all of your faces here. Thank you so much for joining us. I'm Rabbi Sharon Brous, one of the rabbis at IKAR, and know many of you well, and some of you seeing for the first time. I'm so grateful for the opportunity to come together today and have this incredible conversation. Let me start by sharing a bit of background about the Charles Bronfman Prize. This is an award of $100,000 that is given out annually to a humanitarian, or in this case, a couple of humanitarians under 50 years old whose innovative work is informed by Jewish values and has significantly improved the world. This prize was founded by Ellen Bronfman-Hauptman and Stephen Bronfman, along with their spouses, Andrew Hauptman and Claudine Bronfman, to honor Charles Bronfman on his 70th birthday. And there have been some extraordinary recipients who have, from previous years, who've distinguished themselves through their work in environmental justice and humanitarian relief, human rights, medical and public education, food justice, criminal justice, and the arts. And we are so excited to have this public conversation with this year's recipients of the Charles Bronfman Prize. I want to welcome the Bronfman family, including Charles and Rita, Ellen and Andrew, who are beloved IKAR members, and Andrew, wishing Andrew a happy birthday, celebrated his birthday just yesterday, and Stephen and Claudine. And of course, my beloved sister-in-law, Paulette Light, who is the executive director of the Bronfman Prize. And we're so grateful to you for bringing this extraordinary pair of people. I just called you a rabbi, Jessica. Dr. Ari Johnson and Dr. Jessica Beckerman, who are this year's recipients. So before I formally introduce them, we're going to share with you a little short video about the organization that they founded, which will give you a better sense of what their work is all about.
Muso ka laɲini tɛ dɔwɛrɛ ye bana fɛn fɛn bɛ n'an bɛ se ka kisi a ma ani an bɛ se ka furakɛ olu kana se ka kɛ mɔgɔ si sata ye furakɛli ni joona nafa fɛnɛ ka bon den ka banako la kosɛbɛ. Banije muso yɛrɛ ye sigida kɛnɛya sinsinbagaw sigi dugu kɔnɔ minnu bɛ yaala k'an denw kɔlɔsi sanga ni waati k'a lajɛ ni bana b'u la.
Si je trouve l'enfant malade, je vais soigner à la maison. S'il n'y a pas de signe d'âge, je vais traiter avec les médicaments à la maison.
Je suis rentrée dans ma zone aujourd'hui. Je suis venue trouver des enfants malades qui sont à la maison et voir leur température. Ensuite, je les ai fait le TDR d'abord.
Et puis, pendant 3 jours, je vais aller chez eux pour regarder si l'enfant est guéri. Pendant 3 jours, si moi j'ai vu le signe de danger, je vais amener à la CESCOM.
Muso ye furakɛli sɔngɔ bin ka bɔ a ka farigantɔw kan. A y'a ka personnel formé n'o y'a baarakɛɲɔgɔnw ye walasa furakɛli yɔrɔ la an bɛ se ka damu sɔrɔ furakɛli ɲuman ka kɛ ani banabaatɔw ka se ka lafiya. bana tɛ digu la kuma tɛ k'u faga o kɛlen saya nana kɛ fɛn ye min dɔgɔyara an ka sigida la kosɛbɛ.
Okay, it's incredible. I've seen the video a few times now, and it is absolutely astonishing what you've done, and I'm so excited to get into conversation with you about it. So let me now introduce to you Dr. Ari Johnson and Dr. Jessica Beckerman, the husband and wife team who respectively serve as CEO and Chief Medical Officer of Muso. First, Ari. Ari is the co-founder and CEO of Muso and associate professor at the University of California, San Francisco, Global Health Sciences. A global expert in community health systems design, Ari trained at Harvard Medical School and completed his residency at the University of California, San Francisco. He has conducted research at UCSF, National Institutes of Health, the International Health Institute and Medical Research Council of South Africa, Brown University, Harvard University, the Kuvan Center for the Study of Infectious and Tropical Diseases in Jerusalem. He has published peer-reviewed articles and essays in the fields of infectious disease, health systems design, socioeconomic determinants of health, AIDS, and migration. And he is here with Dr. Jessica Beckerman, who is the Chief Medical Officer. Jessica has worked in Mali since 2004, where she was a Fulbright Scholar. She completed her bachelor's degree at Brown University, her degree in medicine at the University of California, San Francisco, her residency in obstetrics and gynecology at Kaiser Permanente in San Francisco. And Jessica works clinically as an obstetrician at Highland Hospital, a public safety net hospital, and large teaching hospital in Oakland. Jessica currently serves as Muso's Chief Medical Officer and oversees quality and integrated care delivery from community to clinic to hospital. And before co-founding Muso, she worked in West Africa for Tostan and as a project manager at Partners in Health. I just want to share, Paulette shared with me the incredible nominations application, and one of your nominees, one of the people who nominated you wrote the following: Ari and Jessica are trailblazers in global health and role models for the next generation of social change makers. They are spiritually driven, intellectually curious, deeply humane, insanely ambitious pioneers of global health equity. They're obsessed with providing the poorest and most neglected people on the planet with life-saving care. The organization that Ari and Jessica founded, which we'll hear about in a few moments, Muso, now has a team of over 500 and provides rapid proactive care to more than 332,000 patients in Mali. And it is beyond breathtaking what you've done. So we have another short video about the work that I'm going to ask that we hold until the end, because I'm really eager for everyone to hear your voices. And I would love if we could start, if you can tell us a little bit about your story, Dr. Johnson and Dr. Beckerman. How did you come to this work?
It's first, let me just say it's such a pleasure and an honor to be here and to join this trailblazing IKAR community and to be having this conversation. So thank you for inviting us. So both Ari and I started working in Mali as researchers. And during that work, we met some incredibly visionary young Malian healthcare professionals. And together we moved in to a community called Yurimajo, which is just on the outskirts of Bamako, Mali's capital city. And Yurimajo at the time had one of the highest rates of maternal and child death in the world. And we were really adopted by the community, have family there now, and got to know our neighbors in the most intimate of ways. Early on, I remember sitting, drinking tea with one of my good friends, Ma, in her courtyard, and just hanging out. And another member of her household was sitting near us, and we looked over and we saw that she was holding her young infant in her arms, who was sweating profusely, breathing rapidly, and the family member of Maz was opening capsules of antibiotics that she had purchased on the street out of desperation, because she didn't have another option, and was literally mixing them with breast milk and feeding them to her infant, because that was it was what any mother would do if they didn't have another way to get their child health care. And so Ma and I, we rushed this child and his mother to the health center, and shortly after we arrived and the child was diagnosed with malaria, he died right in front of us on the exam table. And so that happened again the next week, and that happened again and again and again. And we are in our early 20s, I had no idea what it actually meant to live in a place where 1 out of 5 children died before their 5th birthday. And becoming family and neighbors in this place, we got to see what that looked like. And what we learned from our neighbors was that this was not about malaria. This was about not having the money in your pocket to pay the fees for the medication, or to see a midwife or a doctor when you were sick. It was about not having a vehicle to get to the health center in time, not having childcare to allow you to leave your other children at home. And it was about, fundamentally, it was about delay. What we saw was that people were dying because they didn't access care, often very simple care, that we have had tools to treat many of the illnesses we saw for decades, and people weren't accessing care in time. And so Muso was born out of that, because this was not just a problem of Yiri Majo. This was half of our world does not access healthcare in time. And so our common moral failure to care for each other and to ensure through the basic human dignity of not dying because you don't have access to healthcare was something that we motivated us to start Muso together with our Malian colleagues, a small group of Jews and Muslims and Christians, and that's brought us to today. This was 15 years ago. Yeah.
Ari, will you tell a little bit of from your perspective also how you came to this work now?
Thank you. And it is so meaningful to be here with all of you, to be in the IKAR community, and to be talking about this work that is so core to our own Jewish practice, and with our Jewish community, and with this particular Holy Tehillah. So for me, I remember right after I graduated from college, there's this afternoon I was reading a book from one of my professors called Pathologies of Power about inequities in healthcare. And I stopped to daven mincha, to do the afternoon prayer just before sunset. And something hit me that it just hadn't gone through the rest of my life prior. I realized that all my life up till that point, when I was doing tshuva, when I was thinking about tshuva, I was asking for forgiveness for the sins I'd committed, things I'd done wrong. And I realized that the big tshuva that I needed to do, and the big tshuva that we need to do as a society is actually about not just the sins we committed, but our sins of omission, what Rabbi Heschel called the evil of indifference. All the healing we have the power to realize and make in the world, but when we fail to act. And I was, alone in my apartment, I just started crying. And that moment launched me on this journey. And a number of years later, I'm in so many experiences followed that have taught me on this path. But a few years later, I was on the edge of the Sahara with our teammates, with Mali's co-founded by Malians and Americans together. And we were on the edge of the Sahara visiting a rural clinic, this remote rural area. And we walk into the maternity. And I opened the door to the delivery room, and it's all dark. The windows are boarded up, and I see through the darkness that the only thing there is a rusty metal table and a sturdy bucket. And what comes to my mind is imagining bringing my own wife or someone I love in my life to give birth there, to give life there. And I just started crying because I felt like I was at a crime scene and that I was an accessory to the crime. It wasn't even an articulate question, it was this feeling of how could we have all let this happen? How could we have gone to this place where when and whether someone gets care, whether someone's life is treated with dignity depends so much on the color of our skin, where we were born, where we live, how much money we have in our pocket. And not just by a little difference. We're talking about right now, we valued people's lives differently by orders of magnitude, like 1,000-fold. We have, in the past 15 years, been splitting our time between medical training in some of the most beautiful and advanced medical centers in the world, where we don't bat an eyelash to spend $500,000 to keep somebody alive. And it's so beautiful to be a part of that celebration, affirmation of what we can do to protect the human life. And, a week later, we could be talking with USAID officials in Mali telling us, this $20 price tag, it's just not sustainable. We can't afford to spend $20 on healthcare for a person. So that feeling that we're culpable by inaction, and that we have a responsibility to act, that's driven us in this work. And the rabbis have so much to teach us about that radical moral mandate. But just getting to be a part of this work, you take your first step in it, you get to be a part of seeing one kid come back from the brink of death with a few dollars worth of medicines, a little bit of effort. You get to see how little it takes to transform somebody's life. You get to see that once, and for me, I just got hooked. I needed to be part of that again and again and again. I couldn't imagine anything that I could possibly be part of that is more meaningful than that. So that's been what's propelled us, part of what's propelled us on this journey.
Thank you so much, both of you, for sharing that. So much of what you're saying resonates so powerfully. And I'm thinking about, I spent a little bit of time in Liberia with American Jewish World Service with Ruth Messengers some years ago. And we had a very similar experience. We went, we were in a, I wouldn't even call it a village. It was a small community that was pretty far from any even neighboring town. And they took us to the birthing center, which was a place that was open from 10 a.m. until 4 p.m. only on weekdays, because the people who came there to help, were coming, they would have to travel many, many hours to get there. And I asked, well, what happens if someone goes into labor, at 7 p.m. or at 9 p.m.? I mean, I think I went into labor every time in the middle of the night for my own children. And they said, nobody's here. Like they would have to walk to this place and find it, you know, closed up for the night. And we walked around inside and I saw what you saw. I saw like I mean, there was no running water, and it made me feel some shame that I had been able to give birth 3 times in this most beautiful state-of-the-art hospital in Los Angeles. And I didn't deserve it. Why did I get that kind of treatment while somebody else gets this? And you know, I really resonate to how you look to not only to see the inequity, but also to see the culpability. In some ways, once you see it, you are responsible for it. And I'm so moved by how driven the two of you have been to actually take that feeling of guilt and not let it shut you down, but instead motivate you to do something so powerful. And in the video that we just saw, I mean, the rates are extraordinary. The rates of child mortality in the areas where you've worked have dropped significantly, precipitously since you started the work there. And so it feels like that's a testament to the very premise of the work. And I'm really interested, I mean, did you expect when you set out that you'd be able to see such a marked difference in such a short period of time from when you set out on this incredible effort?
I mean, yes and no. I think we were all a bit taken aback by how dramatic the results were so quickly, and yet it was also aligned with what we were hearing from doctors and nurses at the health facilities that we work with, that, you know, they weren't seeing kids dying anymore. It was aligned with what we were hearing from the imams and priests that officiated at burials, that they weren't burying children anymore in the community, and what we were hearing from others. And I think it was also not surprising in the sense that the diseases that cause 1 in 5 kids to die, and you know, circa 2005 in Mali, are entirely preventable and treatable, and often very easily if people can access care in a timely fashion. So, like malaria kills most people within 48 hours of symptom onset. Most kids who die of malaria, and yet you can treat it with like 3 days worth of pills for $1 or $2 if it's caught early. And so the whole model that we built with our colleagues and with the communities where we work is designed to try to reach people quickly, so that which actually renders healthcare much simpler in many circumstances, and very feasible. Not to say that complex care is not also necessary, and which is why we work with the health system more broadly, not just at the community level. Do you have anything you'd add?
That's right.
You know, it's interesting. You've spoken and written about the way that your Jewish values and the Torah has really been a driver for you in the work. And I want to talk a little bit about the idea of tsalamelohim, the idea of all people being created in God's own image, and to think about what it means to build policy and practice around a true devotion to the idea that we're all created in God's image. Because what I think that you're pointing to in that moment of awakening that you both described, witnessing this child die before your eyes from a preventable illness, witnessing this obstetric center, you know, and seeing these iniquities, is that in reality, and we talk a lot about this at IKAR, but we have these core foundational beliefs as Jews, and the world makes a mockery of those beliefs. We live in a country and in a world of profound inequality and inequity. And I think that's it's so painful for people who really believe it, to live in this world, and even paralyzing. There's a Mishnah that I just want to share with you for a moment, this text that I'm so moved by, that I've been thinking a lot about lately. And it comes right after one of the core texts for me, Mishnah Sanhedrin, chapter 4, that really is about the dignity of every single human being created in the image of God. This is a Mishnah that comes in chapter 6, where Rabbi Meir says that when a person is in distress, he asks, what does God say? What is the language that God uses? Ma lashon omeret. What is the language the Shekhinah uses, that God's presence uses? And the language is, oi, my head is in pain. Oh, my arm is in pain. And it's so powerful. Our Rabbi Meir, our rabbis are actually envisioning that when people suffer, it's as if God is suffering. And God feels the pain of that child, and God feels the pain of the woman in labor who, walks 4 hours to get to a clinic that's closed. And so if we can actually, as people of faith, hold that image, there's no way we can't act, right? You can't live in a reality in which God is suffering like that, and God's own image is suffering like that, and then just go home and unsee what you've seen. And so I wonder, I'm really interested in that kind of transformation where we take a faith commitment and an epiphany, and then it ends up becoming the roadmap for the rest of your lives. And the two of you built this thing together, sort of rooted in that core principle. Do you feel now, as you're actually engaging in the work now for some years, has that commitment deepened for you? Do you feel, is there an affirmation for you that this path is the path toward the realization of human dignity, toward the manifestation of the Shekhinah, of God's presence in this world? And can you talk a little bit about like some of the counter image to the images that you've brought, like some moment where you've seen that dignity manifest, where it's actually worked, and because of the work that you're doing, you've seen an incredible, miraculous recovery or some kind of story of survival and healing?
Sure. Yeah. So thank you for sharing that beautiful Mishnah, which I hadn't had a chance to learn before. And actually, just before in Mishnah Sanhedrin, the rabbis they discuss what for me is one of the most haunting and powerful verses of the Torah. It comes with the murder of Abel by Cain in Bereshit, in Genesis. And after Cain kills his brother, God calls out to Cain and he says, Kol dmei achicha tzoakim alai min ha'adama. The blood of your brother is calling to me from the earth. And the rabbis of the Mishnah discover something surprising and unusual hidden in that verse, which is kind of an apparent grammatical error, in that it doesn't say the blood of your brother, it says the bloods, plural, called dmei achicha. And the rabbis ask, why does it say that everything in the Torah is on purpose? So why does it say the bloods of your brother? Why is this pluralized? And the rabbis pull from this is, so from the eternal lens, from the lens of God, if we strive to see things, see all people in the tsalamelohim, from the divine image, it wasn't just Abel who died, it was all the generations that could have come from Abel. It was the generations before him and all the generations that could have come after him. From God's perspective, a single human life is like an entire world. And so they draw from this 2 lessons, each more radical than the one before. So first they draw the lesson that someone who takes a life, who kills, it's like they've destroyed an entire world. That's how weighty murder is. And they say in the same sentence, someone who saves a life, it's like they've saved an entire world. And that piece, actually, the juxtaposition, putting these 2 things together is where I think the rabbis get really radical about this, what you're talking about, this kind of devotion, right? Because they place the imperative, the moral imperative to save a life, on the same level as the moral imperative not to kill. That, and Rambam Maimonides teaches us that saving life is actually a positive commandment, something we're obligated to do. It's not like a nice to have or a good deed. It's a core to being alive. It's required of us. We have to act. And when we get to live that, that's something that Jessica said that really moves me. That's when we get to feel God in the room, right? When we get to be part of that kind of action, when we get to be part of that kind of healing. And we live in a world today, right now, where it has never been easier in human history, never. For any of us, not just me or Jessica, but any of us here, it has never been easier for us to save a life. And any of us could do it sitting right here in our chairs, from wherever we are. We have so much power to heal. And that gives me great hope. The injustices that we've witnessed, they may seem immense, but they're not distant from us or unsolvable. They're so solvable, and we have so much power and opportunity if we act together to heal, to make it happen, to realize this vision that the rabbis paint of a beloved society, not like the politics of selfishness that we see, where we sometimes in this country can barely commit just to pay our taxes to each other, but where we can make a different kind of commitment to each other, that I live through you and you live through me. Our lives are bound up in this common fabric.
We say that the results that we saw in Yuri Majo are extraordinary, but that they shouldn't be. Yeah. They should be the story of our world. They should be the case everywhere for every community. And I think that that's why it's so incredible to be having this conversation with the IKAR community, with just our community as Jews. We don't get to talk about this that much, really ever. Just the how core this work is to being a Jew and to our practice as being a Jew. It's like, as important to my practice of being a Jew as the kashrut or observing Shabbat or whatever we do in shul. And I think the Torah is quite radical about this idea of how we should love our fellow human as ourselves. I am God, right? It's like this notion that we should care for each other, and that our devotion and our love for each other, even for strangers or for our patients as healthcare professionals, should be on par with the care that I have for my son or for my sister or for my own self if I were sick. And when we can start operating from that place, and it sort of changes just the structures of our society and of what is possible.
Yeah, I agree. And I think there's something truly radical about what Torah offers us. And, especially in this time where we're kind of intoxicated by the idea of radical individualism, as if we're not all connected to one another, as if we don't fundamentally belong to each other. And this work is that is a powerful counter testimony to that claim. With the incredible access that we have now to information, we both have the opportunity you said it's never been easier in human history for us to save someone's life. Part of that's because of technology and because the world has gotten smaller in some ways. Like, we could actually make contributions that could enable doctors and healthcare workers in Mali to engage in basic preventative medicine, which could save people's lives. It also means that there's an abundance of knowledge and information that we have access to. And I want to talk to you for a couple of moments about about the idea that there's a professor named Paul Slovic, who I've been following for years, who writes about psychic numbing. And he actually, I think that his initial study was about a child in Mali, actually, if I'm remembering correctly. But the idea was that when the way that we're wired as human beings is we're wired to be empathic toward other human beings. And so when you see somebody bang their knee, you kind of like, it hurts your body for a second. And we have this sort of natural, mirror neurons. We have this empathic response to each other. But when we see that multiple people are suffering, not one person, our reaction is severely limited. And so, and the more suffering there is, the less likely we are to actually do something about it, because we become psychically numb. It's a kind of learned indifference that comes with feeling overwhelmed. And so we disengage. And so I wonder how, I want to ask two parts to this question. Have you overcome that psychic numbness in yourself? How do you not look at the suffering and say, my God, it's just too much. It's just too great. I can't address it all. And so it feels like, the starfish from the sea story. Like there's just that, whatever I do is going to be, there are going to be 10,000 more children who are going to die today from preventable disease. How in your own spirit do you strengthen yourself against that very human reaction? And then I have a second part, which I'll save until after you address the first part.
Mm-hmm. When we get close to each other, when we actually move in with each other, the more we listen to each other and try to understand, the stories, the experiences, the wisdom of individual patients, the more we listen to and learn from patients, and I think we do have opportunities to do that. The more we do that, the more we find opportunities to connect and to realize that despair is a luxury, and it's a luxury that those facing oppression and poverty cannot afford, and it's a luxury that those of us with privilege and power morally we can't afford. And so what's the antidote? I think the antidote is action. It's listening, proximity, getting close, and it's action, starting with direct actions of care, which we all can do, even from thousands of miles away. Either resources or sweat equity that we can put in can actually provide healthcare that enables someone to live. And it takes so little. On a micro level, we're talking about $10, $20, $30 for healthcare for a person. And on a macro level, we're talking about maybe tens of billions of dollars, but something, an amount that we could provide collectively as a global community, healthcare for every single person on the planet. And the resources that would take to do it, we wouldn't even miss it. It is so comparatively little. It is so achievable. And so the way we think about it at Muso, we begin beside patients, learning from them and caring for them. And that orients everything else. And then we embed with that research to understand how to change systems. And then we embed with that advocacy and changing systems and structures, so that we actually change the social contract at national level, at global level. Just to give an example of that, what does that look like, right? So a few years ago, I get to follow one of our community health workers, Sally, as she's doing her door-to-door rounds in the Malayan sun. And after a couple hours of this, I get ready to say, thank you, Sally, it's been incredible. I try to say goodbye. And she says, we're not done. And she says, because Sally explained, every patient I care for, I visit them again. I go back to their home to meet them where they are, 24 hours after, 48 hours after, and 72 hours after. And so we need to do the follow-up visits today. And so she took me to a household where these twin babies were living with their parents. And one of the twins, a little girl, she had treated for diarrhea 2 days before. And just during her follow-up assessment, she noticed something which at the time was super subtle, a little pulling in of the abdominal muscles on the chest that she was trained to see, a quickening of her breathing. It was subtle at the time, but she realized it was a danger sign, said, oh, we need to get to the clinic right away, grabbed the little one and her mom, and we all rushed over to the clinic. And then from there, the doctor diagnosed hypoxemic respiratory failure, getting not enough oxygen, and we activated an ambulance, got the baby to a hospital onto oxygen, and all of this took something like an hour. And even in that very short period of time, the baby started to lose consciousness, her eyes started to droop, and I was asking my question, wow, what would have happened if Sally hadn't said, oh, my commitment to my neighbor begins the moment they need me, and that means me showing up for them and going to their doorstep, not waiting for them to come to mine. What would have happened if we'd waited just a few hours longer? And so this very simple act of going and knocking on her neighbor's door enabled Sally to save a life. So that's a direct action, and that links to a study with 100,000 people, randomized controlled trial we're doing to actually determine what's the effect, how much impact can we have saving lives if we reimagine what the healthcare system is, and reimagine the moral mandate of healthcare systems everywhere. So instead of saying, oh, I'm a doctor, I was trained at really great places, but trained that my responsibility begins when someone walks through our door at a clinic or a hospital and says, I need care. What if we flip that and say, our moral mandate, our devotion to each other actually needs to begin the moment someone needs sick, wherever they are, and health systems, we need to reimagine them so that healthcare meets people where they are, wherever they are, as soon as they need care. That's practically just a very different kind of healthcare that changes who provides healthcare, where it happens, who pays for it, and how. And so those are very pragmatic and real policy decisions that every nation on earth is grappling with right now, and that we have an opportunity together to advocate change on.
Yeah, and I'm so struck that the first of the 3 steps in that in the video about your organization is actually proactive care, meaning maybe not even waiting for people to get sick, but going to them first and engaging them in this kind of community health practice. And we're just, our system here in the US is so reactive too. And that's one of the things I wanted to address with you. I see that we only have about 13 minutes left. So what I'm going to do before I ask this question is I just want to invite, a few of you have messaged me with some questions that you want to lift up. I want to invite others, if you have questions, to write into the chat so that we can, so that Drs. Beckerman and Johnson can address your questions as well. I remember years ago, we were, Melissa Balaban, who's here with us tonight, who's our CEO, she and I were reading the book that Nick Kristof and Cheryl Wudunn wrote called Half the Sky. And we were struggling with the question of when you fundamentally believe that all human beings are created in God's own image, and therefore nobody deserves to die because they can't afford a $1 mosquito net. So where do you start? what do you do when there's just so much suffering and so much pain? And one of the things that I remember that they write in that book is just put a stake in the ground. Just start somewhere. Don't be overwhelmed. Don't be paralyzed by the enormity of how much there is. You can't solve everything, but you can do something. And it made me, that realization made me retranslate, the famous Lo alecha hamlacha ligmor, that it's that you don't have to do everything. You have to do something. And I think that the choice of Mali, I asked you when we first met, how did you choose to go to Mali? And you said, I believe, we went where the need was the greatest, right? And just started. And I'm so moved by that. And I feel that's a really important Torah for the rest of us, to go wherever we land. The need is profound. And the idea is to start wherever we can. And it does connect to a question that's been raised here that I want to ask you about the United States, because of course you're practitioners in, in San Francisco and also in Africa and Mali. And we see really dramatic inequities in our own healthcare system here. And we see, the even maternal health rates and maternal mortality rates in the United States, which vary greatly based on if a person is Black or white, based on where they live, geography, and also based on on how much money they have. I wonder if you can address this from an American perspective too, for people who are really concerned about, for example, we just learned last week that Black and brown people in America are 3 times more likely than white people to get COVID and to die from COVID. White people are twice as likely as Black and brown people in America to get the vaccine. So how do we begin to address the enormity of the really grotesque inequities that are in our own systems here, as we also contemplate and consider what we might be able to do about a global health crisis?
I love the idea of just putting a stake in the ground, just starting. I mean, it is something that we think about is, this idea of tzedek tirdof, like justice, pursue it, so that you should live, that we have to pursue justice to live, practically, but also morally, if we were going to be morally alive, like if we're going to be alive in the world and awake in the world, that we just have to be open to connecting to the rest of the world, including people that live next door to us or who live on the other side of town from us, who live on the other side of the world from us. And when we start to put up these barriers and we allow ourselves to get psychically numb, we close off from this opportunity to be fully alive and to fully connect with Hashem. And so I think that, pursuing justice in this way is fundamentally Jewish, and just like all of Jewish practice, it is a practice. We don't maybe have like a perfect approach to kashrut, or haven't perfected our skills at reading Torah, each moment in our lives. And so in the same way, pursuing justice is a practice, and thinking of it as part of our spiritual practice, I think, is something that has resonated with me. In terms of healthcare in the United States, absolutely. I mean, I see the hospital I work in every day, I see exactly why Black women are 3 times more likely to die in childbirth than white women in the United States. And there are so many different ways that we could, the disparities are enormous. I think going back to kind of the fundamentals of Muso's like origin story, for me, it helps to illuminate like what needs to happen here as well, and in the hospital I work in the United States as well, which is, again, it's not about a disease. It's fundamentally about delays and like what are the different reasons why people are not getting access to the care they need in a timely fashion. And it often comes down to really simple problems that have simpler remedies, like user fees. There's no reason why people should still be required to pay copays when that is a burden and delays their access to care in the United States, really anywhere in the world. 60 years of literature of research that show that.
Yeah, so, there are a number of very practical things that we can do, whether in the US or in Mali, both domestically and globally, to address this. One thing that you're talking about, I think about a third of people in the US have delayed getting care because of healthcare costs, because of out-of-pocket fees, bills they cannot pay, catastrophic spending. Catastrophic health costs drive 100 million people into poverty every year. And so it's no wonder that, and that's in Mali, that's in the United States. It's no wonder that so many people, even here in the United States, delay getting the care that they need because of out-of-pocket fees. So we need to relook at our healthcare financing systems in the US to get rid of those. That's a big deal. We also need to meet people where they are with care, whether that's doing a different kind of vaccine rollout to get more proximate to the communities that face the greatest inequities, and bring both vaccination and care closer to people's doorsteps. There's a lot that can be done practically. In terms of what each of us can do, I would say, even if none of us in the room might have the ability to introduce legislation today, right? We have the ability to do a number of things. Number one, we each can donate to organizations that provide evidence-based healthcare to those who need it. So we can actually provide healthcare to people and save lives by donating directly. That's one thing. Another thing is that we can observe the mitzvah of teaching our children, that we can integrate in our families and share about how the injustices of millions of people, including 6 million children dying needlessly every year because they don't get the care they need in time. We can talk about those injustices. We can talk about our duty as Jews. That's a really big deal because not enough people are aware of both the injustice and how solvable it is. And we can share via social media, via our communities and our dinner table discussions about these issues and about what we can do to act. All of those things are very practical things that we can do today that actually can make a difference, direct healing, policy and practice change.
And also confronting, I would add confronting racism, in our day-to-day lives. And as we are teaching our children, I mean, there is no reason why we should be valuing people's lives differently in different parts of the world based on their country of origin. And a lot of that comes down to the color of people's skin, to be, quite honest about it. And so I think that's something that we need to be talking about more.
Yeah, I think that's so critical. We have only a couple minutes left. I want to just weave together a couple of thoughts, and there are a few questions that I would love to, if it's possible, to address them briefly. I'll just tell you, we had one of these moments of epiphany, and I'm noticing this as kind of a theme through our conversation, but there are these, there's sort of small moments of realization that end up changing everything if we pay attention to them. And a couple of years ago, I brought my daughter to the orthodontist to see, she was getting assessed to see if she was going to need braces. And the orthodontist said, "She looks great. I'm just going to encourage you to go get this special kind of x-ray for her," and sent us to this place. We went in, it was $600 in cash and not covered by insurance. And I was so annoyed, like, that's an expensive x-ray and she looked fine. So why are we doing it? And we did the x-ray, and the doctor called that night and said she needs to have emergency surgery. Tomorrow we found a problem with her jaw. And I brought her in the next morning. She went through the surgery. Thank God she was fine. And I just thought, what if we couldn't afford the $600 x-ray? So then my kid's life would have been in danger. And a couple of weeks later, a friend of ours who's a Mexican-American immigrant, his father died from an infection in his jaw that was almost identical to what Sammy had in hers. And he, of course, could not afford the special preventative care x-rays. And I thought, like, what is it? How can we live like this and go on and pretend that this is okay, as if we somehow deserve the care that we got and he didn't? It's yet another poverty related illness. And it's here and it's there. The problem is everywhere. And what I so deeply appreciate about the two of you is that you refuse to be, you refuse to grow complacent from it. You refuse to give up on this. And instead, you're doing exactly what our tradition calls us to do, which is everything in our power to try to reverse course. I know that this work has been complicated by COVID. I know that your travel has probably been severely limited by COVID. And there are a few people who are asking questions about that. There are a couple questions about Mali and the government of Mali and whether or not there's any collaboration or support from the government structures. What I'm going to suggest is, because we have to close, what I want to do is just invite the people who are here with us tonight to be in an ongoing conversation with you and with your work. And I will just say, even though the Bronfman Prize folks did not ask me to do this, that we've just added Muso to our family tzedakah, because I'm so deeply moved by the work that you're doing. And if people are looking for a way to give and have a real impact in their giving, it feels really clear that this is a really important and beautiful project. I want to just close by offering you a blessing. And then we have this 1-minute clip about COVID in particular and what it means to really rush to do good right now. And so I'd love if we could give the last word to Muso, to the organization. But first I want to tell you that this is my alternative life. What you're doing is this is the dreamscape for me. If I hadn't gone to rabbinical school, I would have, I dreamt of going to medical school and doing what you're doing, and you're doing it better than I would have. And so I just want to ask God to continue to bless you with strength, with a really strong moral core that is driving you every single day to do the extraordinary work that you're doing. And, we talk a lot in our tradition about what it means that after the deepest, darkest night, that a joyous morning will come, and you are not waiting for that dawn. You are ushering it in with every ounce of strength in you. And that is an incredible Kiddush Hashem. That is a sanctification of God's name. I know that you don't want the work to be about you, but to be about the work, but you are clearly, you are touched by God, and you've been given the opportunity to use your skills and your talents for good in the world. And I ask God to continue to protect you in the days ahead so that you can keep doing this work. And I hope that you will always get the support and love and strength from Torah and from Jewish community and from our Jewish community that you need as you continue on this incredible work in the days ahead. The video that we're going to see to close is about what it means to really race against the clock in order to engage in the greatest mitzvah of pikuach nefesh, of saving a life. And so I just leave us with this, V'im lo achshav eimatai, this sensibility of if we aren't going to do it now, when are we going to do it? And I feel so very grateful that you have felt compelled to do the extraordinary work that you're doing precisely in this time and in the way that you're doing it. So thank you, Dr. Beckerman, and thank you, Dr. Johnson. Thank you to the Bronfmans for once again choosing exactly the right people to lift up, to amplify the work of, and to help inspire us all to be the very best versions of ourselves that we can be. And with your permission, I'd love to close by sharing this little video clip on the nature of running to do good.
Thank you so much.
Amen, amen.
let's all pick up the pace and run to do good. Thank you so much. Thank you, Paulette. Thank you to the Bronfman family. And thank you, Ari and Jessica.
Thank you, everyone.
Thank you so much.
What a gift to be with all
It's
of
such
you.
an honor.
Ari and Jessica generously included their email addresses here. So I hope you'll take them up on it and we can continue the conversation. And one day, hopefully in the not too distant future, we will all meet at IKAR on a Shabbos morning and celebrate together. Thank you.
Yeah, it's so incredible. This is amazing. Thanks for having us. Thanks for being with us today.
Well.